Hello friends, today we are going to discuss on herpes genitalis. Herpes genitalis, or it is also called as genital herpes. It is caused by viruses, herpes simplex virus 1 and virus 2. There are two categories. HSV1 is commonly associated with herpes outbreak, and mostly it is causing the herpes symptoms on the face, whereas HSV2 is more often associated with the herpes genitalis, that is the genital herpes. So coming to its clinical features, you can see the difference between the oral herpes and the genital herpes. Oral herpes occurs on the face or the mouth, and there will be formation of small blisters on the face, called as cold sores or the fever blisters, and the sore throat. These are the commonly symptoms seen in the oral herpes, whereas the genital herpes has a fewer symptoms and it forms blisters that break open and results in the ulcers that heal within 2 to 4 weeks. Genital herpes is caused by the HSV1 and HSV2. So this incubation period is 2 to 14 days, and it is mostly transmitted by the orogenital contact, and it is commonly seen among the women. And here the clinical features of the herpes genitalis: it starts as a red painful inflammatory area on the clitoris, labia, vestibule, vagina, perineum and cervix, which later turns into multiple vesicles. You can see here in the diagram how the multiple vesicles looks like, and these multiple vesicles, they progress into multiple shallow ulcers, and then these multiple shallow ulcers, they heals up spontaneously by crusting, and this all takes 3 weeks to complete the process, and it is associated with the inguinal lymphadenopathy and the other constitutional symptoms like fever, malaise, etc. things can be seen, burning, itching, etc. things. First episodes are usually severe and compared to the recurrent episodes, that means the primary herpes, it is the first episodes will be severe, whereas the recurrent episodes are less severe. Diagnosis is with the virus culture and isolation test, and detection of virus antigen by ELISA or the PCR test to identify the HSV and DNA. And its treatment is rest and analgesics, acyclovir antiviral therapy, that is mostly the acyclovir or valacyclovir can be